My name is David Remedios.
Hi, how you doing?
I'm a student physical therapist with the University of Texas Medical Branch. What's your name?
My name is Samuel Rosen. How are you?
Nice to meet you.
Glad you came to my house today.
Nice to meet you. Just to make sure that I have the right person today, I wanted to ensure, what is your date of birth?
It's November 21, 1955.
And what is the last four of your social?
2781.
All right, we are working with the right person today. Go ahead and have a seat. I want to get to know a little bit about you, and I wanted to ask about what brings you to physical therapy.
Well, I had a rotator cuff repair about 6 weeks ago.
Okay, what happened during the injury?
Well, I was working out about a couple months ago, or I just was lifting more than I should have. Got a little bit carried away, and I hurt my shoulder. Went to see the orthopedic surgeon, and he actually asked me to go ahead and have a repair. It was a pretty bad injury.
All right. So, are there any other associated symptoms that you're having with the shoulder there? Are you having?
I've been having pain in my shoulder, obviously, but also I feel like some pain in the outer part of my biceps as well.
Absolutely, absolutely. So, do you have any health conditions that I should know about?
Yeah, I have diabetes, and I also have hypertension.
Are you taking any medication?
Yes, for my diabetes, I'm taking insulin and Ozempic. For my hypertension, 10 milligrams of lisinopril.
Do you have any allergies?
I'm not allergic to anything.
Okay. Are you currently working?
Yes, actually, I'm a surgeon, but because of my injury, the operation, I cannot be in the operating room. But I am seeing patients at the office for now.
And are you able to? You're right-handed, correct?
Yeah, that makes it quite a challenge.
Absolutely.
Can't write too well, and it kind of gets in the way.
Are you still able to write scripts?
Yeah, kind of slowly, but most of it I instruct my assistant to go ahead and do it online.
All right. Socially, what is it that you would like to get back to doing?
I want to get back to my normal life, first of all. I know it's not social, but I want to get in the operating room. I also want to be able to get back into the gym and do the workout that I do. I just want to be back to normal life. Being a grandfather, being able to pick up my grandkids, and what have you.
Absolutely. Tell me a little bit about your living environment.
Well, I live at home. I have a 2-story house, and I live on the first floor. There's only one step to getting into the house. So, pretty much, it's a comfortable house, and I enjoy being where I am.
So, tell me a little bit more about the pain in your shoulder. 0 means that you have no pain at all, while 10 means the maximum amount of pain that you could ever imagine. What is your level of pain like?
Well, before the surgery, I was 7 to a 9. Since the surgery's gone down to a 3, 4, maybe.
What were you doing before your injury?
Well, I was just doing workout, bicep, triceps. I was working on my shoulders, just a full body workout, and I was pretty active in the operating room.
And what are you able to do currently in comparison to that level?
I'm in a sling, so I can be in the operating room. I have pain on my shoulder, and so I'm here to see how you can help me get back to normal.
Absolutely. And what are your goals with physical therapy?
My goal is to get back my full range of motion and to get back to the activities I was doing before, like going to the gym.
All right. Now, I did have a conversation with your doctor, and we discussed the removal of the sling. He wants us to progress you to passive range of motion and active assist range of motion. That just means that we'll be moving your shoulder for you, but also you'll be able to move your shoulder with a little bit of help. That will progress as we get into some of these later stages. We're going to get into some more of the strengthening and full range of motion. We do use some assistance.
Okay. Sounds like fair game to me.
Absolutely.
Let's get the show on the road.
So we're going to be checking for any kind of weaknesses. We're going to be checking for some kind of tightnesses or just differences between one side and the other. So to do that, I'm just going to do a few quick tests to see where you're at. Do you mind if we remove this sling?
Well, by all means, go for it.
Okay, here we go. So, if you have any pain with any of these tests, please let me know. Okay. And we can go ahead and support that shoulder here. Straight off here. And, okay, I'm going to put this to the side. Okay, so what we're going to do next is we're going to be checking your incision sites. I'm just going to inspect the skin. So I'm going to roll this sleeve up.
Okay.
Okay. Right here. As we can see, they're closed here. Now, are you using vitamin E cream and cocoa butter like your surgeon recommended?
Yes.
Very good. And as I can feel here, the scars feel pretty mobile and doesn't feel hot to temperature, as well as it appears that the scars are laying down pretty flat. So it looks like you're doing a very good job with management of your scars.
Thank you.
So we're gonna move on to do some more screenings. Okay, are you able to move this hand? Move that, squeeze, give me a squeeze. Okay, turn your hand in and out like this. Okay, what I'm looking for is the quality of motion, and it looks like you're doing okay with these. Okay, now what I'm gonna check for here is I'm gonna turn your hand like this, and I just wanna see if you're able to straighten it. Okay, and I'm feeling some tightness there. Is it painful?
Yeah, a little bit.
Okay, yeah, I see that. So we need to definitely address the tightness there in this muscle. Okay, and are you able to support your shoulder? Let me see. I'm gonna let the support out. Are you able to support that shoulder? Okay. Okay. No pain with that?
Very little bit.
Very little bit. Okay. I want to initiate some testing here. I'm gonna get right here. What you're gonna do is you're gonna squeeze both my hands. Okay. Give me a good squeeze. Okay. And I can feel you have decent strength there in both sides. Okay. So go ahead and close your hands like this. I'm going to be pushing straight down. Don't let me move you. Okay. A little bit weaker on this side. Okay. Okay. Put your hands like this. Okay. I'm going to be pushing up. You can make some fists here. Okay. I'm going to be pushing up. Don't let me move you. Okay. A little bit weaker on this side again. Okay. And don't let me move you. Same thing. Okay. And don't let me move you. Okay. So it seems like you're having a little bit of problems with your stability on this side as well. The movement seems a little shaky. We want to definitely address that with our physical therapy. So you can go and release the fist here. Okay. Next thing we're going to be checking for is I want you to lift your shoulder like this. Okay. At that level. I'm going to support you. I'm going to go up we're going to go up as far as we can.
Oh, that's
right there. You're not able to go past that.
a little bit. Yeah.
Okay, and back down. Okay, good. Okay, give me full range of motion on this. Go up as far as you can. Okay, are you able to hold that without any help? Okay, and hold. Go right by the ear. There you go. Very good. Back down. Okay. All right. Next thing we're going to check for, I need to look at your shoulder blades to see if they're level. So what I'm going to have you do is I'm going to have you sit on the opposite side here. Are you okay with removing your shirt for me?
Sure.
Okay.
Yes.
So go ahead and walk on over to this side of the plinth, and we're going to be checking for that. So I'm going to help you with removal of the shirt, and we're going to be inspecting for any kind of muscle asymmetry. Okay?
Okay.
So I'm going to assist you with this shirt. So I'm going to come straight off. Okay, elbow down. I'm going to go straight through. There you go. Like that. And I'm going to drape this over just like that. Perfect. Okay. So what I'm looking for is the shoulder blades. And camera can go ahead and come on over this way so we can see the symmetry. Okay, so what I'm going to have you do is I'm going to use this rod. You could use your good arm to help the bad arm. So hang on to it right here. And you're going to be going straight up. And actually use the top grip. Just like that. That's good. So I want this arm to help this one. Go straight up as far as you can. If you have pain, go ahead and go on down. Okay?
Just about there.
Okay. And back down. Okay. And what I'm feeling here is that this shoulder blade was a little bit less tone on this side and was further out. So we need to address that stability. Okay. Would you be okay with laying on this side for me? So you're going to be laying down.
That'll be fine.
I'll move this rod. Very good. Okay. Okay. I'm going to be checking. So what you're going to do is you're going to pull this bone. You're going to pull your shoulder forward here. Okay, that's good. Now, you feel the heel of my hand. You're going to be pulling this shoulder blade back into my hand. Push, push, push. Okay, that's actually pretty good strength. Now I'm going to be pushing up. Okay, allow that. And then go ahead and pull down against my hand. Okay, that feels like it's a little bit weak there. Okay, so we need to work on that. Okay, now what you're going to do is you're going to be pushing straight out, straight forward against my hand here. 3, 2, 1, and that certainly feels a little weak. So we want to address that, certainly. Okay, you can sit up and we're going to go ahead, I'm going to assist you with putting the shirt back on. Let's turn here a little bit. There you go. Reach back through the sleeve and back on. Very good. Okay. You having any pain? You doing okay with this position?
A little bit on this side.
A little bit on this side. Okay. I'm feeling on that. Is that painful to touch there?
Yes.
Okay. All right. And it looks like we also do have some tone here on this side, and that probably is coming from the pressure of that sling from being on your precautions for so long. So that is expected, but we can certainly address that as well. Are you having any pain on this side?
Not so much.
Okay. All right. So at this point within the assessment, I'll be doing 3 tests. Manual muscle testing for the serratus anterior. I'll also do manual muscle testing for the bicep and external rotators of the shoulder. I will be doing bicep length testing as well as passive range of motion of the right upper extremity.